I've been asked to talk about fat transfers with regards to breasts and breast augmentation. And obviously, there is a trend away, not necessarily a trend away, but certainly there are some concerns about breast implants with regards to breast implant illness syndrome and even ALCL. And so fat transfers or fat grafting is a technique which is fairly long-standing now, where fat is essentially liposucked from one part of a person's body and then injected or feathered into another part of the body. It's commonly used in the reconstructive setting for breast reconstruction, but in recent times we've been using it more and more for patients in an aesthetic setting for their breasts. With my personal practice, I tend to only use fat grafting or fat transfers in the setting of a breast implant. And the purpose of that is to try and hide the implant a little bit better by thickening the skin and soft tissue that's over the implant. So for some women who are particularly thin and petite, you can get some rippling or some palpability of the implant, which means you can feel it under the skin. And so some fat transfer over this area helps to camouflage the implant and give a more natural appearance and a smoother, more natural feel. I personally don't do large volume fat transfers to augment breasts primarily without the use of an implant. Maybe that will become more of a part of my practice, but at this stage I still have some concerns about what the effects of fat transferring are on breast tissue itself. In Australian women, breast cancer is a common cancer, and whilst there is certainly no evidence linking fat transfers at all to causing breast cancer per se, I would still like to wait a little bit longer to see what the evidence bears out before performing such a procedure. When it comes to breast reconstruction, however, after someone has already had a total mastectomy, so all the breast tissue has essentially been removed because of breast cancer, then absolutely I have no concerns about relatively large volume fat transfers in that setting. That's usually after, however, I've rebuilt and reconstructed a breast. Usually if I've used tissue from the abdomen, for example, to reconstruct a breast, then putting fat in to get a larger volume and a slightly more projected shape is usually when I do fat transferring in that setting.